The bill is passed.
For decades, they've been trying to do it. It has now been done.
I think you've got to give the president his due here. This was a very difficult fight, and ultimately he's making good on something that he promised to do.
After a century of striving, after a year of debate, after a historic vote, health care reform is no longer an unmet promise. It is the law of the land. It is the law of the land.
The bill of the Affordable Health Care Act was signed into office on March 23, 2010. A major issue in the United States is that the public is not getting health insurance. This leads to many people suffering from injuries or illness that could be treated but weren't. This is a problem because it also can be contagious and spread diseases. The bill started out as a suggestion and idea for the last century proposed by presidents such as George H.W. Bush, Bill Clinton, and George W. Bush.
Right to adequate medical care.
Healthcare is a fundamental challenge that this country's faced for a long time.
Comprehensive health insurance is an idea whose time has come.
Healthcare system of ours is badly broken.
We have tens of millions of people without health insurance.
Almost 46 million people in this country do not have health insurance, but the problem is a lot bigger than that. Many people who do have insurance still cannot afford the care that they need.
We've got people who were getting a raw deal from their insurance company.
President Obama went more in depth. He was having problems with uninsured people coming for treatments in hospitals. Uninsured people are going to the emergency room for minor injuries and sickness. Taxpayers had to pay for uninsured treatment. People being treated at hospitals can be very expensive. In the U.S., it costs about $2.3 trillion a year to have a functioning healthcare system. In the bill, it stated that 20% of the money spent on healthcare could go to the healthcare insurance broker. The rest has to go to actual healthcare, otherwise you will receive a rebate.
Nearly 13 million of you will receive a rebate from your insurance company because it spent too much on things like administrative costs and CEO bonuses and not enough on your healthcare.
In the bill, it also made it so insurance companies could no longer turn someone down for a pre-existing healthcare condition.
Can't be dropped when you get sick and you need insurance most.
You can't be denied a health insurance plan because of a pre-existing condition that your child may have, which affected hundreds of thousands of people.
Republicans say they want to take down the law, but many healthcare experts think it would be more expensive to abolish the law than it would be to keep it.
The American public is not behind this bill, and we need the American public behind the bill.
Millions would lose coverage if the law was removed. Mandate says everyone has to be on some sort of plan, otherwise they will face fines. Starting in 2015, a $325 a year fine will be charged for adults that are uninsured. For kids, it'll be $162.50, or 2% of your family income. Whichever is higher will be charged. We had an interview with healthcare insurance broker Julie Dunnigan.
I think the expense is just going to grow as more and more people become part of the healthcare world and obtain insurance. Many of these people, because the Affordable Care Act and the exchanges that are available are based on income, many of the lower income people are getting insurance, and those people aren't necessarily paying premiums, but rather going to the county to get this insurance.
The Affordable Health Care Act, on average, increased a family's spending on healthcare by $7,450 for a family of four with healthcare pre-ACA. Over 105 million Americans no longer have lifetime dollar limits on their coverage thanks to the Affordable Health Care Act.
My name is Stacy Lynn. I'm from Phoenix, Arizona, and the Affordable Care Act is saving my daughter's life. I was still pregnant with Zoe when she was diagnosed with a congenital heart defect.
Come on, Zoe.
Before the Affordable Care Act, health insurance companies were allowed to set lifetime caps on how much coverage each individual was provided. By 6 months of age, Zoe was halfway to her lifetime cap.
That's an orange.
The thought of her hitting that cap
and not having the opportunity to continue on health insurance is frightening because we can't pay those medical bills. I mean, that's why we pay premiums.
Many liked the act and were helped by it.
Women, the sick, survivors, they deserve fair treatment in our healthcare system. All of which makes the constant politics around this law so troubling.
From 2010 to 2014, some people were given a rebate for things they had to pay for other people, but were relentless when they got the money back from the people they had helped.
It wasn't just that small businesses were seeing costs skyrocket and they couldn't get affordable coverage even if they wanted to provide it to their employees. It wasn't just that this was the biggest driver of our federal deficit, our overall healthcare costs, but it was families who were worried about going bankrupt if they got sick. Millions of families all across the country. If they had a pre-existing condition, they might not be able to get coverage at all. If they did have coverage, insurance companies might impose an arbitrary limit. And so as a consequence, they're paying their premiums. Somebody gets really sick. Lo and behold, they don't have enough money to pay the bills.
The main issue is that people are not getting the health care they need.
Affordable Care Act is now covering more Americans than was originally projected. Individuals that have pre-existing conditions, heart disease, diabetes, cancer can no longer be denied insurance because of that pre-existing condition. The fact that women can no longer be charged more because of their gender, as well as the fact that insurance companies can not cap you based on a lifetime of expense based on a major illness.